Hi, I'm Dr. Eric Bates. I'm a foot and ankle surgeon at Seaview Orthopedics. I've been here for about 8 years. Today we're going to be talking about insertional Achilles tendonitis. Typically, people first feel pain from Achilles tendonitis on the back of their heel in this particular situation. There are multiple different types of Achilles tendonitis. There's one that's a little higher up in what's called the watershed region. This pain that we're talking about today is where the Achilles tendon actually blends with the back of the heel. And in that area, you have the back of the heel that actually rubs up against the Achilles tendon. And it can cause irritation of a bursa that's meant to cushion the Achilles tendon as it rubs on the heel, and also a second bursa that's between the Achilles tendon and the skin. This is a model of your foot. When we're looking at where the Achilles tendon attaches, it blends to the back of the heel here. And it's a broad attachment. It goes around the sides of the heel like this, but there's one spot on the back of the heel where you see this little shelf of bone, and this model actually has what's called a Haglund's deformity. When you see it upturned like this is a little bit larger than what you typically see with the back of a normal heel. And when the Achilles tendon comes in like this, and the heel moves in this direction, it can rub up against the back of the Achilles tendon and cause irritation. Typically, the first treatment that I recommend for this problem is a small heel lift, because that actually rotates the heel a little bit farther forward and decreases the pressure of the back of the heel on the Achilles tendon. Another thing you can do is ice massage. You could take a small ice cube, hold it with a washcloth, and rub it on the back of the Achilles tendon. This really helps with bursitis. And it can decrease inflammation in this area. Physical therapy is also quite helpful for insertional Achilles tendonitis because they can use things like ultrasound and Graston technique, and they can use shockwave and physical therapy to really help treat the problem and decrease symptoms. Unfortunately, because this is a structural problem, and the shape of the heel and the shape of the foot in general ultimately lead to this problem, sometimes this becomes a chronic issue that keeps coming back over and over again. And as it is there longer and longer, there's actually more changes to the Achilles tendon, more thickening, more bone deposition actually in the tendon itself, and more spur formation on the back of the heel, which can make the bump even larger. If it gets to the point where you've exhausted conservative care with a heel lift, anti-inflammatory medications, ice massage, physical therapy, activity modification, etc., then you may be a candidate for either a non-steroidal injection. If you do a steroid injection for the Achilles tendon, it has a very high likelihood of tearing, so I don't recommend that. If we do a non-steroidal injection, it can give you similar benefits to a steroid without the risk of rupturing the tendon. If you don't respond to a non-steroidal injection, you may actually need to have the back of the heel changed a little bit so that the Achilles tendon is not rubbing up against the shelf of bone on the back of the heel. This can be done with an open incision. That's the traditional way of approaching this problem, where the heel is actually shaved off and part of the Achilles tendon is detached in order to get to the back of the heel and then reattached before the incision is closed back up. This leaves a very large incision that can actually rub on the back of the heel and cause pain even after the primary issue has been resolved. I'm doing a new technique that involves an endoscopic approach where we make small incisions, and that allows me to shave the back of the heel without making a big incision. And then we use an arthroscopy system where we take a small camera and visualize the bursa in the back of the heel so that we can clean it up properly before reattaching the Achilles tendon to the back of the heel. This allows people a little bit of a faster recovery and much smaller incisions with less pain. Typically, the recovery process for the procedure where we remove part of the Achilles tendon, shave the back of the heel, and then reattach it is 4 weeks in a cast, non-weight bearing, followed by an additional 4 weeks protected weight bearing in a cam boot, and then physical therapy. Typically, people are walking in a sneaker by 2 months post-op and getting back to sports by about 4 months post-op after that type of a procedure. If you have pain on the back of your heel and you've already done some of the home treatments that I've recommended and you're not getting any better, come see us at Seaview Orthopedics. We may be able to recommend some treatment, either non-operative or operative, depending on how far advanced your situation is.